All right, now, as you no doubt know, either because you have had it or you have been or it's struck down family, friends, or colleagues, we are in the midst of a flu season, and in some areas it's pushing the NHS to its limits. Let's take a look at some of the areas in England with the most flu cases. Now, the darker the colour, the worse it is. I think in the northeast it's faced 1,170 hospitalisations from flu. Unfortunately, we don't have the graphics. This was from the Independent for Wales, Scotland, in Northern Ireland, but that's what it's looking like if you're in England, so you can see where you are and see what stage this crisis is at for you. Critical instances have been declared in at least a dozen hospitals across Britain, including Birmingham, Hampshire, Plymouth, and Plymouth yesterday, due to rising cases of flu and other respiratory illnesses actually as well. And patients at the Royal Liverpool Hospital have faced 50-hour waits in A&E. Now, according to NHS England, the number of patients hospitalised with flu has quadrupled in the last month, reaching more than 5,000 by the end of the Christmas season. Now, the average daily number of hospitalisations is almost 3.5 times higher compared to the previous year. I think now we can speak to Dr. Emeka Okorocha, who has been working in A&E this winter and has seen the flu crisis firsthand. Can you paint a picture of what it's been like, Emeka?
Yeah, so seeing patients come through A&E and onto the wards, and then working in GP services as well, it's actually quite significant because obviously cold and flu symptoms normally can be self-limiting, and normally you just have to take over-the-counter measures and you'll be fine. However, we're seeing more and more people coming in with debilitating symptoms that actually need them to have hospitalization and support from us, which obviously then brings a backlog on patients walking in to urgent care centers and to A&E and to the pediatric department. And this is obviously causing a problem for more patients and then obviously staff as well.
And when they say critical incident, I mean, that's obviously quite a shocking thing to hear, but what does it actually mean in practice?
As in, so when they say critical incidents, it's basically patients who are very unwell and need to actually come in and have hospital care. So a lot of the time, patients can come in, they could be assessed, and we could do a number of things such as, take blood tests, do ECGs, do a chest X-ray, and potentially send you home with advice, care, and maybe even antibiotics if we feel you have a bacterial infection. However, if it gets worse than this and you need severe care and hospitalization and even escalation, this is when it gets critical. And this is what we're trying to prevent. So that's why we're advising people, if they can, to be able to get vaccines, because what this does is this is going to limit, hopefully, the symptoms that you experience if you then come in contact with somebody who might have a flu, for example.
But the hospitals are declaring a critical incident. What does that mean? What sort of pressure are the hospitals under at the moment?
Well, it basically means we're overwhelmed. So when we're in hospital, we have targets we have to meet and safety measures where we feel if it goes above this, it gets to a point where we deem it unsafe. So sometimes this may be taking patients to a different hospital, for example, because we don't have the staff or the beds to be able to treat them effectively. And this is where it gets critical. And that's kind of what we're trying to prevent and avoid. And unfortunately, most of the hospitals in the NHS are now finding themselves in that kind of position where we feel it's critical because the waiting times and targets that we have to meet that we deem patients are safely in our care and can be safely treated are now not being met in a number of different aspects. And that's what's making this critical.
We're also reading in the papers today that there are ambulances waiting sort of 18 deep in the front of hospitals, just waiting to let their patients out, and also being redirected to other hospitals. Are you seeing that where you've been working?
Yeah, I have been seeing that where I've been working, unfortunately. And we have quite a good unit and we're quite efficient in terms of treating patients, but it's just workload and supply and demand. The more patients coming in and the more ambulances bringing them, you can only see so many patients at once when you deem it safe. As in, you have to safely take care and discharge or admit whoever you're seeing. And the thing is, when this happens, when ambulances build up and you can't get the patient seen, they're kind of just stuck there, which means less ambulances on the road and more patients suffering for longer waiting times in ambulances, in corridors. And this is just what we don't want to see.
And I know you've been working predominantly in pediatric A&E, and I
Yeah.
think when we think of the flu, we think of it as maybe an older person's problem.
Mm.
Are you seeing a lot of children coming in with the flu?
Well, a lot of children are coming in with flu-like symptoms and could be diagnosed with the flu. We've actually seen kids come in with COVID. We've seen obviously younger kids come in with bronchiolitis. And the thing is, all these kids are going to need the same support system. So we're going to have to do the same thing in terms of taking care of them, taking bloods, giving them fluids, giving them support, potentially antibiotics, and then eventually getting them out. However, the thing is, we've had issues where the wards have been too packed and we've had to redirect people to different hospitals and different tertiary centers and ask people if they can stay at home. And I don't want patients to be thinking, oh, the hospitals are too packed. I don't want to bring my child in, or I don't want to go in myself, although you feel very, very terrible. And this is why I advise definitely calling 111, because if your symptoms do escalate and you do need care from hospitalization, for example, you do need to be bringing yourself in despite how overwhelmed we might be.
Well, that's the other thing, actually, bringing yourself in. I know if you're pediatric A&E, obviously a parent has to be with the child, but there has been calls
Yeah.
to ask people in order to stop the sort of crowding in A&E to actually come on your own and not bring other people with you. Is that fair advice?
Oh yeah, that would definitely be fair advice. Because if you look at some of the hospital waiting areas, like, for example, in an A&E or a same day acute unit center, as in it's just difficult to even house people. You have people who are standing for hours who are not used to that, and this obviously is going to put more pressure on them. So unless you need, for example, you're a child and you need to come with a parent, or you're a carer, for example, you have some sort of cognitive impairment and you need somebody with you, or you need a translator with you, then I advise definitely coming by yourself.
So the big question that we're asking now, I'm going to put to the panel later, is do we need free vaccinations for all? What would you say to that?
I would definitely suggest yes, we need free flu vaccinations for all. Obviously, in practicality, if you can, all those who are eligible to get the flu, who are obviously high risk individuals or hospital or care workers like myself, make sure you go and get your jab. They were giving free jabs on the wards when I was working there actually last month, and I made sure to get my COVID and flu jab because I knew what was coming because I've seen it so many times. And I've had flu-like symptoms, but luckily I haven't been hospitalized. I'm hoping it's due to the fact that I've been vaccinated. But yeah, I would definitely suggest that everyone should, if eligible, get it.
Okay, Dr. Emeka Okorocha, thank you very much for your time. What do you make of that then, Lowri? Are you a fan of everybody getting the flu vaccine?
Um, I think it has to be a choice. Um, I think the problem is that we all remember COVID so well, and as soon as we talk about mass hospitalizations, we all think, oh my goodness, it's going to be like COVID all over again, and it's going to be a nightmare. And actually, I think we need to calm down a little bit. We do always have a winter flu season, and we've got a winter flu season. And again, I think as a legacy of COVID, for 2 years we didn't really mix. Now we're mixing like billy-o. So all those people who perhaps didn't get flu back then, now they're wide open for when the flu virus comes around. I did a bit of research before I came on air and thought, okay, how many people die of flu a year? Well, it's the latest figures for last year were 17,000. That's 17,000 too many, obviously, and that's awful. That's your family. But obesity kills twice as many, 31,000. Okay. Now, we're not panicking. Oh my God, it's an emergency. We're worried about it, but we're not saying, right, you have to take Ozempic and we're going to provide Ozempic and we're going to fund that. It seems to be flu, which can be prepared for every year it's a crisis, and that's what we need to look at. I mean, I'm interested that children are coming in with, because I think, like you, I had assumed it was mostly older people. And then one of the issues is bed blocking, is that they've got nowhere to put somebody. So actually, let's sort out social care so older people are not bed blocking, and let's actually think about health in a much broader way, about all the other things that we don't panic about. I think just like I'm a bit like, Dad's Army, don't panic, don't panic.
Do you think we're overly panicking about this, Bobby?
I don't think so. I think listening to the story from Dr. Emeka, hearing about how hospitals are overwhelmed, I think actually more than just free flu jabs, I would say actually it should be mandatory flu jabs. And the reason is,
mandatory
I almost think mandatory,
jabs?
yeah, I would almost suggest that. And the reason is that one is to protect individuals, to protect the NHS, and then back to protecting individuals, because we know that during the winter months, it happens every single year, people catch flu, get really ill, and those that are vulnerable sometimes sadly pass away. And because people get flu and go into hospitals, this overwhelms hospitals in terms of bed space, doctor usage, which means that other people with other conditions can't get seen. And then that means that individuals get harmed again. So it's almost like a negative cycle there. So I think that everyone that can get flu jabs should get it. But more than that, I think everyone should get flu jabs.
Well, there are obviously people that are already eligible for free flu jabs on the NHS. So now it's your turn to get involved. Please do give us a call. What do you think about this? Should everyone get a free flu jab on the NHS? 0207 862 2222 is the number. But let's take a quick look at the rundown of who is currently eligible for one free on the NHS. Those over 65, people with certain health conditions. If you're pregnant, I've had mine. If you are a long stay resident in a care, you receive carer's allowance or a main carer for an at-risk older or disabled person. You live with someone with a weakened immune system, presumably if you have a weakened immune system as well, and you're a frontline care worker. I wonder whether we can look at some conditions if you're a child. If you're aged between 2 and 3, on August 31st, 2024, all primary school children can get it. Secondary school children in years 7 to 11, that will be in England, so I don't know what the difference would be in Scotland. Children aged 6 months to 17 years with certain long-term health conditions.
We give away a lot. It's quite comprehensive. The list of people who are eligible is pretty long, isn't it?
And there are more in Scotland, Scotland, Wales and Northern Ireland as well, different conditions, I think certain...
Do you not think that just the general hysteria is ramped up? Now when I watch the TV and there's a storm coming, you get amber weather alert, and it's like, just everybody just chill out a little.
Maybe when we see these warnings we panic, but actually what these warnings are to do is just to do exactly that, just to give you a heads up, just to make it clear if you're in Scotland and Wales, you are also offered a free jab they're offering free jabs to prisoners, homeless people, while people who currently work, also people who work in the poultry industry in Scotland and Northern Ireland can also get one for free. And in Scotland, they also offer them to asylum seekers in home office accommodation. Now, getting a flu jab privately generally costs about £20, but should everybody, regardless of age, condition and circumstances, be getting a free vaccine on the NHS to stop hospitals clogging up is really what we're asking here. Kelly from Greater Manchester, what's your thoughts on this? Would you be taking a free vaccine?
Yes, definitely. Hi, good morning. I think it probably would help with the strain of the patients, because my son, he's 27. He ended up in A&E Christmas Eve, spent 5 days in there, ended up with sepsis, didn't realise how poorly you'd get from just having flu. He gets it every year, but he's really fit and healthy otherwise, and just for that to make him so poorly. But the NHS, the A&E, from the waiting times to be seen, to be put on a ward, were absolutely fantastic and amazing. And he was seen within about an hour.
Wow.
I can't fault the NHS. They were just superb, and the care that he received from porters to the nurses to the doctors, it was incredible. I mean, the waiting times I have seen lately on the news, but the local hospital we were at, we were seen within an hour, and they were, he was on a IV straight away within an hour.
First of all,
Fantastic.
just a huge thank you for calling in with something positive to say about waiting times, because you're right, when we hear 50 hours waiting times at A&E, it does scare us and we think twice about potentially going to A&E, but to know that actually it's not happening everywhere, and some hospitals you are going to be seen quicker, and if you do feel like you need to go to A&E, it's important that we still do go. Now, you said your son gets flu every single year?
Every year, not as bad as it was this year. This is the second time he's ended up on an IV.
And does he get a vaccine every year?
No, funnily enough, he's had all the COVID vaccines, but it would not really thought about the flu because of his age. I always just used to think it would affect the elderly more. So I think it'd probably take a strain off if it was offered to everybody. Maybe they wouldn't be so busy. I have no idea.
Well, knowing
it might
that
work, it might not.
Knowing that it costs about £20, would you consider next year maybe getting him the flu vaccine in advance of the winter season, just to give him a bit of a fighting chance to not get it, or not
definitely
display the
I've just made
symptoms
that
quite
call.
as badly?
Yeah.
I suppose if you're getting it every year, it's definitely something to consider. But £20. But then we've got to look at the economic advantages of that. If everybody is given a flu vaccine, it means people will be off work less, even if they're not hospitalised. Is that worth it potentially?
Number one, of
Lowri?
course, they have to guess each year which strain it's going to be. In some years, they guess more, so it won't actually solve everything. I just think we're becoming more and more medicalised. And again, particularly since COVID, there's this feeling coming from the medical community who'd like to jab us for everything. Oh, make sure they get this and make sure now people talk about mandatory jabs. I just think, let's just sit back a bit and look at what is the biggest killers. And obesity is coming up to be the biggest killer because it contributes to cancer, heart disease, stroke, all the other things. And actually, why aren't we looking at that in the same way? Why is there such a focus on?
We do talk about that, Lowri.
We do, but
trying to ban sugar.
But do they fund? They won't fund the weight loss drugs, do they, for people?
No, Kelly. Well, they do for diabetes and certain conditions.
Yeah, but not just for obesity. They won't fund it.
I think if you have a BMI over 30 and you fall under the certain categories at the moment,
you'd struggle to get it on the NHS.
Kelly, thank you very much for your call. Joe from Merseyside, what's your view when it comes to flu jabs? Should we all be getting it for free? Should it maybe be mandatory, as Bobby suggests?
Well, it drives me nuts, absolutely insane. The last 5 years, I can't stand medication, tablets or injections, whatever. But because of all the scaremongering, my family have you've got to have this, you've got to have that. And I've been spiked good style for the last 4 or 5 years. And now they're going on about this flu jab. I've had, even the newest one is called RSV. And it's to do with your lungs, pneumonia or whatever. And I've had that as well. So it's not the case of...
That's not a new condition, Joe. That has been kicking about for a while, but we have seen a rise in it this year particularly, along with, what the hospitals are facing at the moment is just an increase in many different respiratory infections. So you've got the influenza, you've got COVID, you have RSV, and also they've got the norovirus, which isn't a respiratory problem, but it is, I think you would agree, a problem if you get it.
Well, can I just throw another one in? Great Britain, we've been inundated, and the hospital, you can't get an appointment in the doctors, the hospitals are full and everything else. And no one's talking about numbers of people who are coming in the country because it's like gone past the post now. Great Britain itself, we've got loads and loads of people. And whatever happens, shape or form with the flu or whatever, no one's talking about numbers.
Okay, so you actually think so, Joe, you would be a fan of decreasing the number of people in the country rather than increasing the number of people having vaccines. Thank you very much for your call. I should just correct myself. Apparently over the Christmas period, RSV decreased. So I just don't want to scare anybody out there. I don't want to be part of the scaremongering. Absolutely not. Sarah from Surrey, is this just something we need to deal with every year and actually we shouldn't be getting too carried away with it?
No, I would totally agree. I do not agree with mandatory vaccinations. It has to be an individual's choice. But I think if you look at the whole big picture, then to offer a free flu jab to someone, yes, there is a cost to the jab itself. But if you look at the whole picture in terms of the economy with people being off work with flu, the crisis in the NHS because of flu, and the government saying we're looking at more prevention, then surely that should be considered in a huge picture and offer flu jabs to those that want them.
Bobby.
So Sarah, I want to ask you one thing. So you said that you're against vaccination being mandatory. But the problem is if it's optional, and obviously the numbers actually are quite high, but if only like 10% of people opted for it in the vulnerable categories, then we're going to see epidemics of influenza in those age categories and wider. And for vaccinations to work, you need a critical mass of people to get that. And it doesn't happen if you just rely on people saying, oh, actually, I'll pop into the hospital. So we need mass schemes to get people vaccinated.
What do you think to that, Sarah?
No, I disagree with that, in as much as if you have one person that would not or could not have afforded to have paid for a flu jab, if you have one person who goes with flu, who goes to work, who then mixes out in society, that one person is affecting more persons.
Yeah.
Yes, I agree that a mass thing is good, but I do not believe it should be mandatory. That is taking away an individual's rights.
All right,
But
so
if you offer an alternative to one person that takes it up, then that could save an awful lot of money in the long run.
But the number of people who are actually hospitalised as opposed to those who actually catch the flu is tiny. They tend to be vulnerable. They might be very young children. They might be older people.
It might be tiny, but it's causing a huge impact on the NHS and the amount of beds that we have.
One of the things that we as human beings do is we learn to fight disease by catching diseases. That's how we strengthen our immune system.
We could also strengthen our immune system by taking the vaccine, potentially.
But the more natural way to do it is actually to allow our body's defences to work. Now, obviously, it depends on whether you're vulnerable and all those other factors. But this hysteria, my God, quickly, you must jab somebody. Just, actually, we've managed to survive quite well as a human race for many thousands of years.
We have survived. I mean, child infancy has deaths, has decreased since vaccines. So it does help to a certain extent. Thank you for all your calls on that. We're going to get your flu stories later on.